Good day, everyone. Welcome to our rationalization for NLOA 2 LT3, and we will focus on the care of clients with physiologic and psychosocial alterations, Part C, which is basically going to focus on the first one is on the legal and ethical issues in psychiatric nursing. I have 12 questions for this, and let's begin with question number one. A patient in alcohol rehabilitation reveals to the nurse, I feel terrible guilt for sexually abusing my 6-year-old before I was admitted. Select the nurse's most important action. A. Anonymously report abuse by phone to the local child protection agency. B. Reply, I'm glad you feel comfortable talking to me about it. Letter C. File a written report with the agency's ethics committee. Letter D. Respect nurse patient relationship confidentiality. Okay, so in this question, it is very important that we take into consideration the non-violation of the law, because there are laws that regards child abuse, and of course reporting discovered by a profession during the suspected abuser's alcohol or drug treatment differ by state. So it is very important that a law supersedes state law and prohibits disclosure without court order except in instances in which the report can be made anonymously or without identifying the abuser as a patient in an alcohol, drug, or treatment facility. So in this case, the best answer is letter A, anonymously report the abuse by phone to the local child protection agency, and letter B, C, D are actually going to be wrong for this question. Number two, a family member of a patient with delusions of persecution as a nurse, are there any circumstances under which the team is justified in violating a patient's rights to confidentiality? The nurse should reply that confidentiality may be breached. A. Under no circumstances, at the discretion of the psychiatrist, when questions are asked by law enforcement or if the patient threatens the life of another person. The best answer is letter D. Because, of course, the duty to warn a person whose life has been threatened by a psychiatric patient overrides a patient's right to confidentiality. And, of course, the right to confidentiality is not suspended at the discretion of the therapist or of for legal investigations. Number three, a new antidepressant is prescribed for an elderly patient diagnosed with major depressive disorder, but the dose is more than the usual geriatric dose. The nurse should consult a reliable drug reference, teach a patient about possible side effects and adverse effects, withhold the medication, and confer with the healthcare provider. Encourage a patient to increase oral fluids to reduce concentration. The best answer is letter C. So, of course, the dose of antidepressants for elderly patients is often less than the usual adult dose, and the nurse should withhold the medication and consult the healthcare provider who wrote the order. And the nurse's duty is to practice according to professional standards as well as intervene and protect the patient. 4. A patient diagnosed with schizophrenia believes a local minister steered evil spirits. The patient threatens to bomb a local church. The psychiatrist notifies the minister, select an answer which with the correct rationale. The psychiatrist a released information without proper authorization, demonstrated the duty to warn and protect, violated the patient's confidentiality, or avoided charges of malpractice. The best answer for number 4 is letter B, because it is the healthcare professional's duty to warn or notify an intended victim after a threat or harm has been made. Informing a potential victim of a threat is considered to be a legal responsibility of the healthcare professionals, and it is actually not a violation of confidentiality. For letter B. 5. A patient experiencing a psychosis became aggressive, struck another patient, and requires seclusion. Select the best documentation. Patient A. Patient struck another patient who attempted to leave the room to go to the bathroom. Seclusion necessary at 14:15. Plan maintain seclusion for 8 hours and keep these two patients away from each other for 24 hours. Letter B. Seclusion ordered by a physician at 14:15 after command hallucinations told the patient to hit another patient. Careful monitoring of patient maintained during period of seclusion. Letter C. Seclusion ordered by MD for aggressive behavior began at 14:15. Maintained for 2 hours of that incident. Outcome patient calmer and apologized for outburst. D. Patient pacing, shouting. Haloperidol 5 milligram given, PO at 13, not effect by 13:15. At 14:15, patient yelled, I'll punch anyone who gets near me, and struck another patient with physically placed in seclusion at 14:20. Seclusion order obtained from MD at 14:30. The correct answer is letter D, because documentation must be specific and detail the key aspects of care, and it should also demonstrate implementations of the least restrictive alternative. In justification for why a patient was secluded should be recorded along with interventions attempted in an effort to avoid seclusion. Documentation should include a prescription of behavior and verbalizations, interventions tried and their outcomes, and the name of the healthcare provider ordering the use of seclusion. 6. A person in the community asks, why aren't people with mental illness kept in state institutions anymore? Select the nurse's best response. A. Less restrictive settings are available now to care for individuals with mental illness. There are fewer persons with mental illness, so less hospital beds are needed. Most people with mental illness are still in psychiatric institution, or psychiatric institutions violated patients' rights. Of course, number 6, best answer is letter A. The community is considered to be a less restrictive alternative than hospitals for treatment of persons with mental illness, and the distractors are incorrect and part of the stigma of mental illness. Number 6, alpha. 7. A patient experiencing psychosis asks a psychiatric technician, "What's the matter with me?" The technician replies, "Nothing is wrong with you. You just need to use some self control." The nurse who overhears the exchange should take action based on a technician's unauthorized disclosure of confidential clinical information, the violation of the patient's right to be treated with dignity and respect. Letter C, the nurse's obligation to report caregiver negligence. Letter D, the patient's right to social interaction. This answer for 7 is letter B, because patients have the right to be treated with dignity and respect, and the technician's comment disregards the seriousness of the patient's illness. The code of ethics for nurses requires intervention, and patient emotional abuse have been demonstrated and not negligence. An interaction with the technician is not an aspect of social interaction. The technician does not disclose any clinical information. So answer for number 7, bravo. 8. Number 8. Which documentation of a patient's behavior best demonstrates a nurse's observation? A. Isolates self from others, frequently fell asleep during group vital signs stable, calmer, more cooperative, participated actively in group, no evidence of psychotic thinking, appeared to hallucinate frequently, increased volume on television causing conflict with others, wore 4 layers of clothing, states I need protection from evil bacteria trying to pierce my skin. Number 8, the answer is letter D, because documentation states specific observations of the specific patient's appearance and the exact statements made. The other options are vague or subjective statements and can be interpreted in different ways. 8, letter D. 9. After leaving work, a nurse realizes documentation of administration of a PRN medication was omitted. This off-duty nurse phones the nurse on duty, says, "Please document administration of the medication for me. My password is Alpha 1. The nurse receiving the call should fulfill the request promptly, document the caller's password, refer the matter to the charge nurse to resolve, report the request to the patient's healthcare provider. Answer C. Because fraudulent documentation may be grounds for discipline by the Board of Nursing, and referring the matter to the charge nurse will allow observance of hospital policy while ensuring that documentation occurs. Notifying healthcare provider would be necessary when the charge nurse can resolve the problem, and the nurse should not provide passwords to others. Number 9, Charlie. 10. Which individual diagnosed with mental illness may need involuntary hospitalization? An individual A who has a panic attack after her child gets lost in a shopping mall. B with visitors of demons emerging from cemetery plots throughout the community, who has 38 who takes 38 acetaminophen tablets after the person's stock portfolio becomes worthless. Or C, diagnosed with major depression who stops taking prescribed antidepressant medication. Answer here is letter C, because involuntary hospitalization protects patients who are dangerous to themselves or others and cannot care for their own basic needs. Involuntary hospitalization also protects other individuals in society. An overdose of acetaminophen indicates dangerousness to self, and the behaviors described in the other options are not sufficient to require involuntary hospitalization. 10. Charlie. 11. An aide in the psychiatric hospital says to the nurse, "We don't have time every day to help each patient complete a menu selection. Let's tell the dietitian to prepare popular choices and send them to our units. Select the nurse's best response. A. Thanks for the suggestion, but that idea may not work because so many patients take MAUI or monoamine oxidase inhibitor, such as an antidepressant. Thanks for the idea, but it's important to treat patients as individuals. Giving choices is one way we can respect patients' dignity. Letter C, thank you for the suggestion, but the patient's Bill of Rights requires us to follow patients to select their own diet. Letter D, thank you, that is a very good idea. It will make meal preparation easier for the dietary department. The correct answer here is letter B, because the nurse's response to the aide should recognize the patient's rights to be treated with dignity and respect as well as promote autonomy. This response also shows respect for the aide and fulfills the nurse's obligation to provide supervision of the unlicensed personnel. The incorrect responses have flawed rationale or do not respect patients as individual. 11. Bravo. 12. In order to release information to another healthcare facility or third party regarding a patient diagnosed with mental illness, the nurse must obtain signed consent by the patient for release of information stating specific information to be released, a verbal consent for information released from the patient and the patient's guardian or next of kin, permission from members of the healthcare team who participate in treatment planning, or approval from the attending psychiatrist to authorize the release of information. Answer Alpha. Nurses have an obligation to protect patients' privacy and confidentiality, and clinical information shouldn't be released without the patient's signed consent for the release. That's number 12, Alpha. Let's have the second part, which is care of adult clients in grief and loss. Let's have question 13. A nurse talks with a woman who recently learned that her husband died while jogging. Select the appropriate statement for the nurse. At least your husband did not suffer. B. It's better to go quickly as your husband did. Or C. Your husband's loss may be very painful for you. Or letter D. You will begin to feel better after you get over the shock. Answer Charlie. The most helpful responses by others validate the bereaved person's experience of loss and avoid cliches because they are considered to be ineffective. Answer Charlie. 14. Family members, as a nurse, what can we say when our loved one's death is coming soon? To promote communication, which response could the nurse suggest for family members? A. We feel sad when we think about life without you. B. We have not given up on getting you well. Letter C. Think you will be around for a long time yet. Letter D. Let's talk about the good memories we have. Answer 14. Alpha, because that is considered to be an emotionally honest response. It allows the family opportunities to express emotions and address issues in the relationship and say farewell. The distractors are considered to be evasive. 14. Alpha. 15. Which finding indicates successful completion of an individual's grief and mourning? For 2 years after her husband's death, a widow has kept her husband's belongings in their usual places. B. After 15 months, a widow realistically remembers both the pleasures and disappointments of his relationship with his wife. C. 3 years after her husband's death, the widow talks about her husband as if he is alive and weeps when others mention his name. Or letter D. 18 months after a spouse's death, an adult says, I have never cried or had feelings of loss, even though we were very close. 615, the best answer, bravo. Because the goals of mourning have evolved from doing the grief work, getting over it, and moving on with life. The work of grieving is over when the bereaved person can remember the individuals realistically and acknowledge both the pleasure and disappointments associated with the loved one. The individual is then free to enter into new relationships and activities. The incorrect option suggests that there is a maladaptive grief. 15. Bravo. 16. A child drowned with swimming in a local lake 2 years ago. Which behavior best indicates a child's parents are mourning in an effective way? The parents forbid their own children from going swimming. B. Keep a place set for for the deceased child at the family dinner table. Seal their child's room exactly as the child left it 2 years ago. Or letter D. Throws flowers on the lake at each anniversary date of the accident. Answer Delta. Having a loss of a child is among the highest risk situations for maladaptive grieving. Depending on many factors, this process can take many months to a number of years. The parents who throw flowers on the lake on each anniversary date of the accident are openly expressing their feelings. The incorrect options indicate the parents are isolating themselves and are denying their feelings. 16. Delta. 17. A patient with pancreatic cancer says, I know I'm dying, but I am still alive. I want to be in control as long as I can, which reply by the nurse shows active listening. A. Our staff will do their best to manage your pain. Letter B. Your mind and spirit are healthy. Letter C. All it's important for you to let others help you to ease their own pain. Or letter D, are you saying you want people to stop focusing on your diagnosis? Answer, bravo. The patient has strengths and capabilities and is asking for acknowledgement that he or she is not incapacitated. Even though the diagnosis is likely terminal, the correct answer provides that acknowledgement and other responses are tangential. 17, bravo. 18. A terminally ill patient says, I know I will never get well, but the patient's voice trails off. Select the most therapeutic response by the nurse. A. What do you hope for? Letter B. Do you have questions about what is happening? B. You are not going to get well. It is healthy that you accept that. Letter D. When you have questions, it is better to talk to the healthcare provider. The correct answer here is alpha, because that's an open-ended response and it's an example of following the patient's lead. It provides an opportunity for the patient to speak about whatever is on his mind. The distractors are not therapeutic. They block further communications, refocus the conversation, give advice, or suggest the nurse is uncomfortable with the topic. 18. Alpha. 19. A hospice patient tells a nurse, life has been good. I am proud of being self educated. I overcame adversity and always give my best. I intend to die as I live. The nurse planning care for this patient would recognize the importance of A. Providing aggressive pain and symptom management, B. Helping the patient reassess and explore existing conflicts, C. Assisting the patient to focus on the meaning on life and death, or D. Document supporting the patient's use of own resources to meet challenges. Answer for number 19, Delta. The patient whose intrinsic strength and endurance have been a hallmark often wishes to approach dying by saying optimistic and in control. Helping such patients use their own resources to meet challenges would be appropriate. Answer for number 19, Delta. 20. A widow repeatedly tells details of finding her elderly husband not breathing, performing cardiopulmonary resuscitation, and seeing his pronounced death. Family members are concerned and ask, what can we do? The nurse should counsel the family that they should express their feelings to the widow and ask her not to retell the story. The retelling should be limited to once daily to avoid unnecessary stimulation. C. Repeating the story and her feelings is a helpful and necessary part of grieving. Or D. Retelling of memories is expected as part of the aging process. 20. The correct answer is Charlie, because nurses are encouraged to tell bereaved patients that telling the personal story of loss as many times as needed is acceptable and healthy, because repetition is a helpful and a necessary part of the grieving process. 21. Charlie. 22. A staff nurse asks a hospice nurse who should be referred for hospice care. Select the best response. Hospice is primarily outpatients diagnosed with cancer. Letter B, patients in the end stage of any disease are eligible for hospice. Or letter C, hospice is designed to care for patients experiencing end stage renal disease. Or patients diagnosed with degenerative neurological disease are eligible for hospice after paralysis occurs. The best answer for 21 is Bravo, a hospice service care for terminally ill patients regardless of diagnosis. 21, Bravo. 22. Which event is most likely to precipitate grief across a community? A local bank is robbed twice in a single month. B. An adolescent shoots the principal of a local high school. Letter C. The elderly pastor of the town's largest church dies of heart failure. Or letter C. Concrete pilings crumple in a bridge important to movement of local traffic. 22. The correct answer, Bravo. The correct response is actually identifying an event likely to be perceived as a public tragedy. The distractors are occurrences that more commonplace. and they may precipitate concern but not grief. 22. Bravo. 23. Which action by a nurse are most appropriate when caring for a hospice patient? Select all that apply, giving choices, fostering personal control, explaining curative actions, supporting the patient's spirituality, offering the interventions that convey respect, providing answers to the patient's questions about spirituality. The correct here is letter A, B, 1, 2, 4, and 5. That's letter C. That's 1, 2, 4, and 5. Giving choices, fostering personal control, supporting the patient's spirituality, and offering interventions that convey respect. Wrong point number 3, because that's the hospice, no curative anymore. And then spirituality is not your responsibility. That is for the chaplain. 23, answer Charlie. 24. Which patients meet criteria for hospice services? Select all other apply. 92-year-old diagnosed with acute pneumonia and late-stage Alzheimer's disease. 54-year-old diagnosed with glioblastoma and life expectancy of 8 to 10 weeks. 16-year-old with type 1 diabetes, multiple infections and substance abuse. 74-year-old newly diagnosed with chronic obstructive pulmonary disease and life expectancy of 2 years. Or a 36-year-old diagnosed with multiple sclerosis complicated by major depressive disorder and pain associated with muscle spasm. 24. The answer is only 1 and 2. Because hospice services are available to patients with terminal illness and an expectancy of less than 6 months, the patient must choose hospice care rather than curative treatments, although patients with other health problems experience complications, treatment focusing on cure, which exclude them from hospice services. 24. Letter B, 1 and 2. 25. As death approaches, a patient diagnosed with AIDS says, I do not have any money, any energy for many visitors anymore, and I'm embarrassed about how I look. Only I want to see my parents and sisters. Which action should the nurse take? A. Encourage the patient to reconsider this decision so that interested and caring friends can provide support. Support the patient to share the request with parents and sisters. Assist family to inform the patient's friends of the requests, suggest the patients discuss these wishes with clergy, or place a no visitor sign on the patient's door. The answer here is D, 2 and 3 only. That empowers the patient to maintain dignity, control personal space, and confidentiality as some patients approach death, they begin to withdraw. In a stage of acceptance, and many patients exhausted and tired, and interactions on the social nature are a burden. Many prefer to have someone present at the bedside who will sit without talking constantly. The answer for 25, Delta. Let's proceed now to the third part of uh, the topic. Let's start with question number that is all about care of adult clients in anger, hostility, and aggression. Question number 26. You are caring for a patient, Baldo, who has a history of aggression. Baldo begins to clench his fist and pace. The intervention that is most appropriate for you to implement first would be, the answer here is, bravo. Ask Baldo to describe what he is feeling. So that is actually correct. Letter A is eliminated because that's too restrictive. Letter C is eliminated because restraints are last resort. Letter D is eliminated because commands may provoke further aggression instead of de-escalating. Answer 26. Letter B, because that is first intervention for early aggression. 27. During your assessment, you noted that patient Baldo has been with intermittent explosive disorder and has been admitted for aggressive outbursts in the past. The most effective intervention for Baldo to prevent future episodes would be to encourage him to recognize triggers, allow him to release anger physically, administer sedative medication at least as a first sign of aggression, or isolate him to prevent conflict. Answer for 27 is letter A. That is to prevent future aggression. Letter B is eliminated because that reinforces aggression. Letter C is eliminated because over medication and no patient learning, and that's not preventive. Letter D is eliminated because that leads to poor coping skills and worsen social dysfunction. 27. Alpha. 28. Shortly after Baldo's admission, he reaches the crisis stage of aggression. A priority intervention for him at this is A. De-escalation techniques. B. Discussing coping strategies. C. Medication administration if ordered. Or D. Encouraging self-reflection. Of course, the best answer for 28 is letter C, because that is a crisis stage of aggression. So letter A, eliminated because that's appropriate in early stage, not when crisis is present. Letter B is eliminated because that is not appropriate when danger is imminent and patient is not receptive. Letter D is also eliminated because that reflection can occur after safety has been restored. 28, Charlie. 29. Based on your assessment of Baldo's behavior, which nursing diagnosis would be most appropriate? A. Risk for self-harm related to aggressive tendencies. Letter B. Social isolation related to withdrawal from others. Letter C. Disturbed thought processes related to delusional thinking. Or letter D. Ineffective coping related to difficulty managing anger. The correct answer is Delta, because that's the best nursing diagnosis for this question. Letter A is eliminated because that is focuses on outside aggression, not self-harm. Letter B is also eliminated because the patient is aggressive and not withdrawn. Letter C is also not the correct answer because there's no evidence of delusion or even hallucination. Answer Delta. 30. When formulating a nursing diagnosis for Baldo, which factor is most important to consider? His history of aggressive behavior and triggers. B. His preference for isolation and quiet environments. Letter C. His response to sedative medications in the past. Or letter C. His ability to interact positively with staff and peers. 30. The correct answer is alpha. That's the most important factor for diagnosis. Letter B. Not the primary priority. Related to aggression. Letter C is also relevant but secondary to knowing triggers. And letter D, that there's an improvement. That's already an improvement indicator, but not a diagnostic tests. A diagnostic basis. 30, letter A. 31. Which nursing intervention best aligns with nursing diagnosis of ineffective coping related to difficulty managing anger, encouraging Baudot to express his feelings in a journal, providing immediate sedation to prevent aggression, avoiding discussions about his triggers to reduce stress, ignoring aggressive behaviors to avoid confrontation. Answer Alpha. That's considered to be the nursing intervention that is for ineffective coping. Letter B, that's eliminated because that prevents coping development and that is used for crisis. Letter C, avoidance that will actually going to cause coping will actually never develop. Letter D also, that reinforces negative behavior and increases risk. 31, alpha. 32. You are also working with patient Benny who frequently displays hostility towards self-staff others. The best approach to address his behavior would be ignore his hostile remarks, confront Benny aggressively, ask other staff members to handle Benny, use firm but calm communication. Answer Delta. Letter A is strong because it escalates behavior and that lacks accountability. Letter B increases hostility and possible violence. And letter C, avoidance undermines therapeutic relationship. 32, Delta. 33. Patient Ben is diagnosed with antisocial personality disorder. His record shows frequent display of hostility. The best approach for him is to establish clear rules and, and consequences, show extreme empathy to calm him, engage in power struggles to maintain authority, avoid confronting inappropriate behavior. 33, the best answer, alpha. B, that is an extreme empathy, may be manipulated, and that reinforces lack of accountability. Letter C, that makes aggression worse, and that is unsafe. Letter D, enables inappropriate behavior. Answer, alpha. 34. Which nursing intervention is most effective in managing Benny who has become a violent patient? Speaking softly while maintaining eye contact, be standing too close to him using quick sudden movements, allowing him to move freely around the unit. Answer, alpha. because that's actually one way of managing violent behavior. Bravo, that violates personal space and that can trigger fight response. Letter C are actually seen as threatening and that can actually increase aggression. Letter D increases the risk of harm to others. 34, alpha. 35. You're teaching Benny anger management techniques. Which a strategy is most effective? Encourage suppression of anger. B. Teach deep breathing and relaxation techniques. Letter C. Allow aggressive behavior to continue until exhaustion. Letter D. Advise him to release anger by yelling. Answer B. Deep breathing and relaxation. Letter A. That can lead to explosive buildup of anger. Letter C, that's actually dangerous and enforces violence. And letter D, that encourages maladaptive behavior. Answer, bravo. 36. Based on Benny's history of hostility, which nursing diagnosis would be most appropriate? Risk for violence, directed at others related to impaired impulse control. B. Social isolation related to withdrawal from interactions. C. Deficient knowledge related to anger management techniques. D. Anxiety related to unfamiliar environment. Answer, alpha. Letter B. He interacts aggressively and the patient is not withdrawn. Letter C. Anger isn't due to lack of knowledge, but it's actually on control. Letter D. Not the primary issue affecting safety. 36. Alpha. 37. When planning care for Benny, which outcome would best indicate improvement in his behavior? Benny continues to display hostility, command towards staff. Benny avoids all social interactions to prevent conflicts. Benny demonstrates the ability to express anger in a controlled manner. Or D. Benny becomes physically aggressive less frequently. Answer for number 37. Letter C. Letter A is strong because that shows no improvement. Letter B, maladaptive coping, not therapeutic. And letter D, that shows improvement but is still unsafe and actually considered to be not the goal. 37, Charlie. Thank you so much for your cooperation. See you again next time.